Hi, I'm Dr. Shane Howell with Alternative Health Management here in Houston, Texas, and I'm going to show you my hip routine. The hip routine will affect obviously not only hips and the pelvis, but the lumbar spine and low back, the rest of the posture, as well as knees and feet. So one of the most important things I put across to my patients is to make sure those hips are moving well, our pelvis is lined up. One of the big things I look at when a patient comes in is how well their pelvic system is aligned. So is it tilted? And if it's tilted, it changes the angle of the hips, which will hyperextend the knee, put a lot of pressure on the feet as well. It almost puts all the pressure on the balls of your feet. So you'll see people when they're walking around, they almost look like they're walking all on the balls of their feet and their heels never touch the ground, essentially. So I'm going to go through a series of exercises and stretches to really help the mobility, the fluidity, the smoothness of movements of the hips, because the hips really drive a lot of the movements that we do, whether we're walking, standing, getting up and down from a chair, just basic movements like that, as well as golf, tennis, baseball. So for instance, I'm going to demonstrate a little golf swing. So we're down here, and the hips precede the rest of the movement, really coming forward. So if my hips are locked up, I'm going to put a lot of pressure on my back, plus I'll have a really horrible swing, and usually the ball will slice. So it's real important for the hips to be moving, so I'm going to go through my little routine that I do. So first thing I usually do is I do this as like a pre-workout before I do any kind of normal workout. So I go down on the ground, spread my legs just a little bit, okay? Usually a good idea to do this on a padded floor. You could do this on a yoga mat, pillow, or something like that. And so what I do is I'm going to do a big circle all the way around. This really helps to kind of mobilize that ball and socket of that hip joint. I'll do that about 10 times one way and 10 times the other way. All the way around. Because one of the issues with the hips when they get tight is the capsule material around the hip joint is what is keeping it stiff. It's not the ligaments and the tendons, it's the capsule. So this helps to kind of mobilize that, loosen that up. Okay? So the next one I do, and people, if you don't have any confidence in your stability and your balance, stand next to something. So you put your hand on the wall or something. What I'm going to do is swing my leg forward and back to the side and back. Forward, back, around, like a big kind of circle. I'll do that about 5 or 6 times. Now I'll do the other side. Side, back. Forward, side, back. So I'm going to show up from the different position. Okay, it just helps to kind of mobilize the hip as well as get those muscles activated. So next one I do is I'll spread my legs. This is great for golfers, softball, baseball, and tennis as well. But everybody should be doing this one. Spread my legs, and so what I'm going to do is I'm going to lift my heel and turn. Lift my heel, turn my hip. Lift my heel, turn my hip. Lift my heel, turn my hip. If you don't lift your heel when you do that, you're going to grind and tear up your knee. So it's always important to lift the heel, turn the hip. Just get used to that movement. I practice that movement quite a bit because all the little movements we do, whether we're moving box or putting dishes in the dishwasher, I want to be turning my hips. Otherwise you're grinding your knee and you're also twisting and stressing your back. So you don't want to do that. Let the hip do the movement. Okay, the next one I do, I'm going to demonstrate it first without the resistance band. I'm going to lie on my side, bend my legs and just kind of about a 90-degree angle. It's called the claw. So basically the feet stay attached to each other. I'm going to lift it up like that. I'm sorry, not the claw, the clam. Like that. And so usually that's a real easy way to do that. So if you do that 10 or 15 times, then it's just really easy. You want to get something like this little resistance band loop. Put it around my ankles, kind of put it up close to my knees, just below my knees. So same thing, so clam, like that. I'm going to do that about 10 or 15 times, whatever you can do. And then I do the other side, then I do both sides twice, okay? The next thing I do, drive this down closer to my feet. So same position, except this time I'm going to straighten my leg and drive it up sideways and then back. Straighten it, up and back. Straighten it, up and back. I'll do that about 10 times. I'll do the other side, and I'll do 2 sets. Okay. So the next one I like to do is really work out that hip flexor. And the hip flexor is a group of muscles that attaches to the lumbar spine, down inside the pelvis to the front of the hip. And so the first thing I like to do is just kind of get it worked out, bring my knee up a little bit, and push my hand against it. Kind of gets that muscle activated. I'll do that 3 or 4 times. Then I'm going to come down on my knee, like this. I'm going to walk and push my hip forward a little bit, so you get a nice stretch right there. Okay, I'm going to take my hands straight up in the air, tilt away from that hip, and then rotate away as much as I can. And I'm breathing the whole time. It's real important to be breathing when you're doing all these exercises and stretches. Now hold that about 20 seconds. Come back, switch to the other leg, push that hip forward, same position, straight up, tilt away, rotate away, 20 seconds. I usually do that twice. Okay? And the last thing I always want to do, because those hamstrings, those calves get really tight because we sit way too much and they're always contracted. So I find something a little, you can do this on the stairs or some kind of elevated thing where I can put the ball of my foot on it. I'm gonna lock my leg where it's nice and straight. I'm gonna take my other leg just a little bit ahead, push my hip back, and stretch out ahead of me. And breathe. Hold it about 20 seconds. So I'm stretching all the way down and all the way up. 20 seconds. Switch the other way. Same thing. 20 seconds. Okay. Then what I do is I'll do some calf raises. About 5. And then I'll kick my leg back. That activates, gets that hamstring kind of working a little bit, contracted. Then I'll go back and do that same stretch again. Because when you alternate some stretching with a little contraction, you're able to get a little bit of deeper stretch. It really gets those muscles worked out. So this is the routine I prescribe to my patients, and I recommend that they do on a daily basis. This is something I do on a daily basis. I usually do this before I do any kind of other type of workout. So you can do this as your workout or as just part of your workout. But if you want to stay healthy, keep the back, the knees responding well to normal treatment, then utilize this in your routine. Just a little caveat, make sure you are seeing a good practitioner, doctor, qualified health practitioner that is suitable in the spine and joints before starting any kind of exercise or anything like that. All right, thank you.